Assalamualaikum warahmatullahi wabarakatuh and very good day to everyone. First of all, I would like to thanks to 2023 ICAEE International Conference on Applied Electronics and Engineering, ICAEE 2023, for accepting and allowed for this paper to be presented in this conference. So this paper with the title Assessment of Transformer Health Index based on dissolved gas analysis was authored by Azmi, Murad, Aziz, Abdul, Mujib, Muhayeddin, Fahrul, Izwan, Supian, Aizam, Talib, Ahmad, Farid, Abidin, and Syed Mutalib Junid. So this collaborative work is among School of Electrical Engineering, College of Engineering, University Technology Mara, Malaysia Refining Company, Sdn Bhd, and Advanced Diagnostic Service, DNB Labs, Sdn Bhd. Let me bring you to the abstracts of this paper to cover the overall works that has been done in this particular paper. So the transformer health index was invented and is used in the industry to predict the health of the transformer based on the complex weighting calculation of the three main components, which is oil quality, gas analysis, and offline tests. However, so the complex calculation required experts to predict and determine the transformer health index, whether it's okay or not, or in the bad condition. Therefore, in this work, dissolved gas analysis based on transformer condition index prediction was introduced to determine the head transformer fault and diagnose throughout the life of the power transformer based on the artificial neural network. So in this work, we have covered three types of ANN to determine the best model for predicting the transformer health index with the several difference of the neuron types and neuron numbers. So the work in this study include gap analysis, computational model development, data collection, and validation. Then the result shows that ANN Bayesian regulation BR with a 20 neuron is the best model to predict the health of the transformer state based on the DGA variable compared to the other Leavenberg market and scale conjugate gradient SCG to replace the previous manual calculation. Okay, let me bring you to the content that we're going to cover after this. So after this, we're going to touch on the problem statement and to really highlight on the gap and issue what and why what and why of this study has been conducted. Then we're going to highlight on the project objective. Then it followed by the framework of this study, which we cover under the methodologies of in this paper. Then we're going to highlight on the manual calculation which has been used before to calculate the health index for the transformer. Then we're going to introduce to you what is the artificial neural network and the type of algorithm will be used in this particular study. So the findings that we obtained from this particular study will be highlighted in the result and discussion before we conclude the final works and the findings that we have obtained from this particular this paper. Statement of this study. So there are three major things and issues and gaps why this work has been initiated. So the first one is a lack of the accurate models and computation to determine the transformer health index based on dissolved gas analysis. Then the second one, the calculation to determine health index of transformer based on dissolved gas analysis, DGA, parameters are complex and require technical competency to verify and validate the calculation. And then the approach to generate the accurate prediction based on the available model to determine the transformer health index is not available and used in the industry. Technically, the objectives of this work is to determine the types of assessment model based on the result analysis towards determine the health quality of index of the transformer. Then the second one is to define the computational prediction formula to determine the health condition of the transformer based on the respective available dissolved gas analysis parameter. And then The third objective is to develop the computational engine to calculate the health condition of the transformer based on the respective dissolved gas analysis model. Then again, we need to test and evaluate the performance based on the real data of the transformers uh, DJA data. Let me bring you to these methodologies of work for these particular studies. So there are 7 components has been used or has been outlined to complete this particular study. So first, we start with the knowledge acquisition and data collection to obtain all technical papers, works, practice has been used, especially on the DJA to assess the performance or the health of the transformer. Then from the information, they will do a clustering and classify the assessment model. And then we sort out and identify the parameters mapping based on the model. And then we defining the parameter based on the respective model before we come up with the formulation of the computational model. Then lastly, we have developed the transformer computational health index. Then we make some testing, evaluation, and result analysis to determine which one is the best to suit and the most sensitive to define and detect the health condition of the transformer. Bring you to the current practice used by the industry. So they are using the calculation method or they call it as a manual calculation. So every single things will be outlined and then we putting in the Excel to determine or to compute to complete the assessment by having all the variables by using the manual calculation. It's not building it fully automated. So you can see over here we have a key gases main tank, we have a rate of gases increase, and then we have ICAEE gases limit. All these particular variable need to be put every single point, every need to measure by particular parameters before you can compute for the overall health index of the transformer. Four things on the parameters. So we have Segre ratio, then we have the Duval triangles, and then we have to identify. Then you can see that it's more complex to really determine why for the entire things happen over here, the rated or the result will be based on the scoring. We go deeper to the index or weightage. So we could see that there are 3 main important groups of to identify the health index of the transformer. It contributed by the oil quality, dissolved gas analysis, and group offline testings. So which you can see that dissolved gas analysis is the second highest among the 3. So which contributed 20.65% of the overall computations of the transformer health index. So from DGA, dissolved gas analysis component, so there are 5 sub-component under dissolved gas analysis, which is key gases, which contributed 18.66%, IEEE gases 0.75%, rate of gases 0.5%, Segre 0.25%, and Duval triangle is 0.5%. So meaning that you need to measure all the particulars under components or parameters under dissolved gas analysis before you can come up or determine that 20.65% of the contributor factors of the transformer. While the calculation will be based on the scoring. So meaning that you need to really understand that particular parameters before you can come up with the accurate determinations of the condition at that point. Okay, based on the complexities and the gaps has been highlighted in the problem statement. So we start exploring the artificial neural network or ANN. So we are working towards the Levenberg market, Bayesian regulation, and scale conjugate gradient to test whether it works or not for the to assess the transformer health index compared to the manual calculation. Based on the exploration, so we have defined that the rankings for the transformer. So we rank that the transformer with the for the normal condition, the ratio is supposed to be 2.55 to 3.00, which the percentage is within the range 85% to 100%. Then moderate is 2.13 to 2.54, which is percentage about 71% to 84%. And then for the attention, it's about 1.53 to 2.12, which is contributed for the 51 to 70%. And then failed transformer, the ratio is 0.93 to 1.52, which percentage is 31% to 50%. So from the percentage of it, so we have computed that for 78% of the transformers in the good condition, 0 in the moderate, and then 4% in the attention, and then 19%, which is lowest, located to the failure rate or contributed for the 20 of the which contribute to the 2020 transformer from our tests. The numbers of neurons for the test that we have conducted for all the three ANN algorithms that we use in this study. So we have conducted for the 10 neurons, 20 neurons, and 30 neurons. The the entire result for the assessment for the 10 neurons. So for the manual calculation, it Levenberg market, Bayesian regulation, and scale conjugates gradient. So this is a test that had been conducted for 107 transformer. This one is for 10 neurons. The second assessment that have been conducted for the 20 neuron for 4 different computation. So we have one for the actual one is for the manual calculation, and then we have level market, and then Bayesian regulation, and then scale conjugate gradients. So this one is for 20 neurons. So the assessment for the entire of 107 transformers. Assessment that we have been conducted for the 30 neurons for transformer for the 107 transformer for both manual calculate for the entire computation by using the manual calculation, ANM development market, ANM Bayesian regulation, and scale conjugate gradient. Okay, finally we go to the conclusion based on the assessment that we have conducted. So in this work, we have evaluated the 3 types of ANN to determine the best model for predicting the transformer health index, which is the Bayesian regulation was the most effective train in the artificial neural network and compared to the others, which is Levenberg market and scale conjugate gradient. So which the result shows that ANN Bayesian regulation with 20 neuron is the best model for predicting the health index of the transformer state based on the DGA variable compared to the Levenberg market, LM, and scale conjugate gradient, SCG, to replace the previous manual calculation. The work has successfully, and then the ANN is able to help to replace the manual calculation, which suffers numbers of difficulties. With that, thank you very much for listening.